Welcome to this training video on the Lapband system. This guide is designed to support you across all key areas of action. Identify and name the components of the Lapband system. Demonstrate the correct steps for device preparation and pre-op checks. The Lapband system is indicated for adult patients with a BMI of at least 30 or higher and with one or more health problems related to their weight, or patients with BMI 40 or higher who have failed conservative weight loss methods. The Lapband is contraindicated in non-adult patients, those with severe GI, cardiac, autoimmune diseases, alcohol or drug abuse, or who are pregnant or unwilling to follow dietary guidelines. The box includes a size label and a self-adhesive strip that should be attached to patient records. The details about the band type and size should be filled out in the information card and given to the patient. Let's identify the components of the Lapband system, which includes the Lapband, rapid port, end plug, access port needle, and 2 flushing needles. The Lapband system is supplied in a sterile, double packaging with a protective outer container. Carefully peel the back cover of the sterile tray, and using sterile technique, hand the tray to the scrub tech or RN. The 2.0 flex tube is an optional accessory which can be used with the Lapband system. The flex tubing allows the band to temporarily dilate and facilitate the passage of a bolus of food through the Lapband, thus reducing the likelihood of an obstruction and returns to its original state. The calibration tube is not part of the Lapband system kit. It serves as a temporary intraoperative tool to help identify the gastroesophageal junction and ensure accurate positioning of the band. Its use is based on the surgeon's preference and intraoperative judgment. Using sterile technique, provide the scrub tech or RN with 15 cubic centimeters of sterile, non-pyrogenic isotonic 0.9% saline solution and a 10 cubic centimeter syringe without a needle. Before opening the Lapband box, confirm the size and type of the Lapband system with the surgeon. Do not open or discard the sterile access port needle unless specifically requested by the surgeon. If unused, label it with the patient's name and return it to the surgeon for future Lapband adjustments. If requested by the surgeon, provide the anesthesiologists with the calibration tube, which is packaged and sold separately. Keep the 10 cubic centimeter syringe ready and filled with saline. Attach the priming needle and syringe. Flush the Lapband vertically with saline to remove all air bubbles. The Lapband should fill with approximately 4 cubic centimeters of saline. Insert the end plug and place the Lapband in a saline bowl until ready for insertion. After the Lapband is placed, remove the rapid port along with the 22-gauge blunt flushing needle from the sterile tray, using sterile technique. The blunt flushing needle fits loosely inside the rapid port tubing and should not be inserted into the port septum. Hold the rapid port upright, with the port at the bottom and the port tubing pointing up. Attach a 5 cc syringe filled with saline to the blunt flushing needle. Slowly inject the saline to irrigate the rapid port. This will expel all air and excess fluid through the tubing past the blunt needle. The rapid port and tubing are now filled with saline and ready for use. Once flushed, the rapid port is connected to the tubing end of the Lapband such that the stainless steel tubing connector disappears into the open end of the band tube. A 4x4 gauze sponge may be helpful to grasp the slippery tubing. Or, when the Flex 2.0 tubing is provided, please prep accordingly. Do not cut or trim the Flex tubing. If trimming of port or Lapband is required, avoid excessive shortening that can lead to kinking or bowel obstruction. Connect the Flex tubing to the Lapband tubing by fully inserting the stainless steel connector. Fill a sterile syringe with 10 cubic centimeters saline, Attach the blunt priming needle and insert it into the open end of the flex tubing. Flush several times, replacing air with saline, holding the syringe up. Inspect the inflatable portions for leaks or uneven inflation. After purging air, inject approximately 3 cubic centimeters saline, then disconnect the syringe and needle. Excess saline will drain, leaving approximately 1 cubic centimeter in the tubing. The flex tubing is now ready to connect to the rapid port. A 4x4 gauze sponge may be helpful to grasp the slippery tubing and push it over the stainless steel connector until flush and fully connected. After flushing, connect the 2.0 flex tube securely to the rapid port. Verify a snug fit with no leakage, such that the stainless steel tubing connector disappears into the open end of the tube without backwalling either tubing end. A 4x4 gauze sponge may be helpful here. Pull the black safety cover off the bottom of the rapid port and discard it. The tubing is advanced into the abdomen using atraumatic forceps while ensuring there are no kinks in the tubing. The port is then placed flat on the fascia and secured with the help of Rapid Port Easy Applier. The Rapid Port Easy Applier is sold separately. The Lapband system is now in position and ready for use. Adjustments are made percutaneously using a non-coring Huber needle and can be guided by X-ray. This needle should be kept sterile and opened only when needed. Thank you for your time. For additional information, please refer to the instructions for use or scan the QR code to access the electronic IFU.